Health Ministry on Monday approved a policy under the National Digital Health Mission to protect and manage personal data of patients using the digital services of the scheme. The policy that was approved by Union Health Minister Harshvardhan acts as a guidance document across the national digital health ecosystem. The government said that this policy is to be read along with and not in contradiction to any applicable law or any instrument having the effect of any law together with the blueprint, the information security policy, the data retention and archival policy and any other policy which may be issued for the implementation of the NDHM. Data collected across the national digital health ecosystem will be stored at the central level, the state or union territory level and at the health facility level by adopting the principle of minimality at each point. The policy was approved after over a month of soliciting feedback from stakeholders and the general public. In this edition of The Big Picture, we will analyze the health data management policy. Joining me on the program today are Shashidhar KJ, Associate Fellow, Observer Research Foundation, and Dr. Praveen Gedam, Additional CEO, National Health Authority. Thank you to my guests for joining me on this edition of The Big Picture. All right, Praveen Gedam, let me start the program with you first. Let's first try and understand the salient features of this policy.
So this policy is an enabling document before we roll out the National Digital Health Mission in its full-fledged form. So what is specifically required here because the National Digital Health Mission is going to deal with the data, which is a health data, which is supposed to be very sensitive, personal, and a lot of sensitivities are attached to it. The way it is attached to bank statement, probably more than that. So we need to have certain protocols in place before we wanted to move ahead. And to decide the way data will be collected, stored, processed, exchanged, the way consent will be given, all that, all those guidelines. This policy was published by Government of India yesterday in order to take care of these issues.
All right. So let me go across to Shashidhar KJ now. Shashidhar, as far as data is concerned or in specific medical data is concerned, how is it important, whom is it going to help and how is it going to help the ecosystem or the health ecosystem as a whole?
Data is of course important for everything right now, but what is more important in all of this is to make sure that the data which is given to different fiduciaries, data fiduciaries, and being shared across different entities, that needs to be protected. And of course, for the entire health ecosystem, as it is envisaged within the document, that it will be shared across different bodies, say from the medical lab to the hospital to the doctor's clinic to whichever place that requires it, including your health insurance provider. In that kind of situation, that access to information about your particular health status becomes very important. But in this framework, you also need to take care of who is actually accessing that data and make sure only the appropriate authorities are accessing that data.
Right. So, Praveen Gedam, as far as these privacy concerns, are concerned, several people have raised several issues really as far as privacy, because you yourself mentioned in your opening comments that this data is highly sensitive, because of, what it is linked with, and it also has highly personal data as well. So, how have the privacy concerns being addressed? How do you see them being addressed?
See, let me start with the clarification that even now, health data is being stored with the respective healthcare providers, either in physical form or in a digital form, whichever format they may be using. What we are trying to do here is only to connect all such healthcare providers by one platform, and they will continue to hold the data at their own places the way they are doing it after complying to certain standards that we have prescribed. Therefore, the data, it's not the case that once I join or let us say a hospital joins a digital health mission, so all the data with that particular hospital which it may be having in its electronic system is automatically made available to everybody. No, it is not. This is just a creation of a network connecting each hospital and laboratory and doctor with every other person. Therefore, if I go to a particular hospital, after doing my blood test in a particular laboratory, the treating doctor can see my report after I give explicit informed consent, and that's it. So when we are talking about access to data, the access to data, the most important reason is to provide a good quality healthcare, and therefore a healthcare provider should be in a position to see the health records of that person across all over India with his consent. And it is also possible to give partial consent. I may say ki, okay, I want to give consent to show my record X and not record Y. That is one. Second, about speaking about authorities, as Dr. Saab has said, as of now, unless we have a specific anonymization and aggregation protocols in place, that will not be done, and it will take some time. Therefore, my point that I want to make through you to our country is that this is just a connection connecting all these individual digital health systems with each other to create an ecosystem to facilitate accessing the data from X system through Y system. That's it.
Right. Just a quick follow-up question since we are here. We are talking about getting consent and partial consent as well. So is there a protocol that needs to be followed as far as getting this consent is concerned? Is there some kind of standardization? And talking about standardization, there has to be some kind of uniformity and standardization across the board as well, because you're talking about the entire country and the entire populace.
Yeah, so I'll respond in two parts. Talking about consent, there is an electronic system which we call as a consent manager. So every request for data will be channelized through this consent manager. The consent manager will verify, number one, identity of the person who is seeking data, number two, identity of person who is providing the data, and also ensure that the consent is provided, and only after that this electronic handshake between two systems will take place. One. After that, when I talk about partial consent, it is possible that I go to a hospital, let us say for fracture of my hand, and I feel that my probably psychiatric disease has nothing to do with this particular medical condition. So I want to provide access to my all records except my psychiatric treatment. So I will be in a position to provide that particular type of consent. I will be in a position to withdraw the consent, and the consent will be provided for a particular period of time only. It's not going to be indefinite. So that's the way we have set up electronic systems to provide adequate control to the data principal, that is the patient. Coming to standards, I understand that medical science, medical nomenclatures are not actually used in a standardized fashion all over India. A same disease, same procedure, same drug can be known by more than one names, all of which may be correct. Sometimes they are used in short form. So we see that this is a start of journey. The data will be accessed by the other doctor the way it is accessed right now. When you go to a doctor and take physical printouts of the other hospitals, the way it is accessed, though it is read the way it is written by other doctors. So something similar will start in the near future, but obviously in the long run we should aim towards ultimate standardization, for which there are international guidelines and there are international codes which are available. But I see it as a journey over some period of time. Till then, whatever is the health data which is getting generated everywhere shall be made available to the other person who is trying to see those data.
Right. So Shashidhar, as far as some of the concerns, what are some of the challenges do you see going forward? What do you think needs to be addressed?
Biggest elephant in the room to be addressed right now is the fact that we don't have a personal data protection bill. So the health policy says that it should be read with applicable laws that will apply. Ideally, this policy should have been under the data protection law, which is still being debated in Parliament right now, and also if we are only looking at data protection right now, the laws that we have are not adequate because we know that the Information Technology Act is not particularly equipped for the challenges of this particular time we are in, and which is why we have been discussing a personal data protection bill. However, there has been a certain amount of granularity which the new policy has come, which gives a certain amount of comfort in the sense that the policy says that it will be reevaluated as and when it comes. So my hope is that once the data protection law is passed, that this policy will be subsumed by it. The other thing which I want to kind of highlight in terms of what happens after a breach, there isn't enough procedures to talk about what happens if a data fiduciary breaches is responsible for a privacy breach. Will that data fiduciary still be part of the entire network? Or what are the kinds of penalties which will apply? Because the data protection bill, which had prescribed a certain number of penalties for people who breach privacy.
I think that's a valid point that you're raising. Let me take that up with Praveen Gedam there. As far as penalties are concerned for any breach, really, if someone doesn't comply with the policy or with the rules or guidelines, what kind of action can we expect to be taken? That is one. And I'll ask my next question as well to you, Praveen, once you answer this.
So in fact, this is intertwined with the requirement of PDP Act. Right now it is a bill. Yes, PDP bill is under consideration and we are in tune with that. Number one. Number two, PDP is not only with respect to health data, but all types of data. Therefore, it is probably will have to be read along with the PDP bill whenever it is passed, but it may not be subsumed because PDP, being a generalist kind of law, will deal with not only health data, but so many other types of data. So the requirement for such kind of specific provisions with respect to health data will still be there. And that is the reason we have come out with this policy, number one. Number two, we have to understand that law is always an evolving process. It evolves as per the requirement of the society. It's always a requirement of society, the way technology advances, way the social customs and values change. So laws keep changing. As of now, also there is a certain principle which has been defined with respect to privacy by Supreme Court. The judgments of Supreme Court has an effect of law. So it is not 100% correct to say that we don't have a legal framework dealing with privacy. We do have in the form of various Supreme Court judgments like Puttaswamy judgments. We do have a general kinds of law which to some extent takes care of privacy, the general laws. And we can definitely use these legal provisions till the PDP bill is passed by the Parliament. Therefore, we do have adequate legal framework as of now. Now, coming to the punishment or penalty will depend on the level of breach. I mean, it can be due to, let us say, somebody misrepresenting himself as one person and trying to. So we cannot say as a straitjacket thing that for this particular thing, this kind of punishment will be given. It will be depending on the type of mischief the person tries to do, the malified intention that it has inbuilt into, and this is true for all crimes, not only for this crime. Yes, there are various provisions, suspension, permanent cancellation from the ecosystem, and then we can also consider prosecuting them in civil and criminal courts as per the existing various laws, but it will depend from case to case. I cannot say what punishment will be given in a general way right now.
Right. So my a follow-up question, of course, let's not forget that the draft policy was kept in the public domain for some time. Now we have the final policy, of course, in front of us. So, what was considerably different? What were some of the things that were worth implementing, the kind of suggestions that you got while it was in the public domain?
Okay, one very important change, if you see, we have explicitly made it clear that the policy will be a dynamic document. It will evolve as and when we get. So it's not that we have reached a kind of dead end and this policy is now cast in stone. No, it's not that. You will see it in the introductory thing itself that we have kept it a dynamic and a fluid kind of policy which will evolve as and when we receive the comments from experts and citizens. That is probably the most important. There were certain other concerns raised about the definition of extremely sensitive data that we have tried to address by specifically making clear that all the health data will be extra sensitive. And there was one concern I specifically remember because we had borrowed the definition of sensitive data from the PDP, so that IT rules, other general law. So along with it, some political inclination, sexual orientation, all these things were mentioned. We have removed that because political inclination, I don't think is required in any case in providing medical treatment. Sexual orientation may be required, but that will depend on the judgment, professional judgment of the doctor, whether he wants to have it or not. And it will be again a one-to-one relation exchange of information between the patient and doctor. So these are minor, so many things which we have addressed. There were thousands of comments. I could broadly categorize them in this particular way.
Okay. So, Shashidhar, data concerns or data privacy concerns aside, would you say that this is a step in the right direction as far as our digital health ecosystem is concerned?
The policy is definitely an improvement from the draft document which is given out. So there were a whole bunch of definitions which were cleared up, which kind of really helped. For example, they mentioned that a consent manager will be used, and they've clarified what the consent manager would look like, that it is actually an electronic consent manager rather than an actual person who would be taking down consent for different things. If you look at the Personal Data Protection Bill, it mentions that, a consent manager is an actual person who will help you navigate your privacy concerns and therefore make you give informed consent. I'm not sure exactly how that would translate into like an electronic consent manager. If you could kind of get a view of how the electronic consent manager, that would be really helpful and also help a lot in transparency. The other thing that you also want to know is how do you get actual proper informed consent? Because the document, the policy right now says that it will be done through Section 14 of under the Indian Contract Act, which says that you are not being misled. The bigger concern with digital systems is that we are mostly relegated to a tick box sort of system where you kind of say, I accept, and I press a tick box over there, and therefore you have read the policy. The concern again over here is people actually making a proper informed consent through this manager. If we do not see how the